Hi, my name is Anna Clemente and I will be doing the cardiac cycle. Let's start with AV valves. AV valves, also known as anterior ventricular valves, prevents backflow of blood from ventricles to the atria when contracting. Cardiac tendinae and papillary muscles plays important roles in the normal functions of AV valves. S1 sound is resulting from the closure of bicuspid valve, also known as mitral valve, and tricuspid valve. S2 sound is resulting from the closure of pulmonary valve and the aortic valve. Aortic pressure is the blood pressure at the root of the aorta, and ventricular pressure is the blood pressure within the ventricles of the heart. Next is the cardiac cycle. The cardiac cycle is a sequence of events that occurs when the heart beats. Systole is the contraction phase of the cardiac cycle, and diastole is the relaxation. During diastole, chambers fills with blood and prepares for the next cycle. Cardiac cycle starts with the atrial systole. Atrial systole is a contraction of the atria, which blood is propelled from them into the ventricles. Isovolumetric contraction and ventricular ejection occurs during ventricular systole. Isovolumetric contraction is when all the heart valves are closed, the volume of the ventricles do not change, and ventricular pressures are rising. Ventricular ejection is when the semilunar valves open and the blood flows into the pulmonary and aortic trunk. Also, the dicrotic notch is sometimes used as a marker for end of systole or ejection period. Isovolumetric relaxation occurs during the ventricular diastole. Isovolumetric relaxation is part of the cardiac cycle between the time of aortic valve closure and bicuspid valve opening, which decreases the tension of ventricular muscle without lengthening so that the ventricular volume remains unaltered. The ventricular diastole and atrial diastole is a relaxation of the atria and the ventricles. Now, this is a simple model of the stroke volume, which is the amount of blood pumped by the left ventricle in one contraction. It starts with a passive filling during ventricular diastole. The amount of blood in a ventricle at the end of ventricular diastole is known as the end diastolic volume. And it is followed by the period of ventricular ejection. And systolic volume is the amount of blood in the ventricle at the end of ventricular systole. Ventricular volume is defined by the end systolic pressure-volume relationship, and ventricular filling is the velocity or flow into the ventricles. And that is the end of the cardiac cycle.